Good day, everyone. So for today, I'll be demonstrating bed making unoccupied. So first, I'm going to assemble all the equipment necessary and putting them on the bedside chair or table in orderly manner, which they will be used later to facilitate performance of tasks. After that, I'll be perform hand hygiene. Assuming that I'm done hand hygiene, I will be adjusting the beds to a comfortable working height to prevent back strain and muscle strain. After that, I will disconnect all the call bell as well as the tubes to prevent damaging the devices. After that, I'll be putting on gloves. And after putting on gloves, I will be loosening all the linens, putting on gloves to prevent the spread of microorganism, and I will be loosening all the linens to prevent tugging and tearing off the linens. Okay. After loosening, I'll be removing the pillowcase. After removing the pillowcase, I'll be folding the linens to save time and then after folding it, I will be snugly rolling it and putting it in a trash bin or plastic bag to prevent the spread of microorganisms. After placing it in a plastic bag, I'll be removing my gloves because they're not necessary for touching clean linens. After that, I will be putting the bottom sheet. After placing half of the bottom sheet, I'll be placing the lift sheet on the center. After that, the drawer sheet here. Next, we'll do the other side. After that, we're going to remove any crease to prevent patient's discomfort and the linen touching the patient's wound. We're going to straighten it out. Once it's all straightened it out, we're going to do the mitral fold. We're going to take the triangle fold here and then place this half of the bed. Here, placing this half of the bed and then folding this back. As well as on this side. As on the other side. After that, we're going to put the top sheet. And then pull back from here. And then hold it in place. After that, we're going to pull this 6 inches to for the patient to be able to easily go inside the bed and pull it back up. Then lastly, we're going to place or put a pillow case inside the pillow, or you put it on the pillow. And then we have to make sure that the pillowcase is not facing or facing the opposite of the door so that we can prevent the microorganism entering the pillow. Like this. Next, we're going to place or put the side rails back up. On each side. And place both, or after placing both of the side wheels up, we're going to give the patients their all bell back so that if they need anything from us, we can quickly respond to their request. And that's it. After that, we're going to dispose all the soiled linens from this bag and perform hand hygiene. That's all. So good day everyone. For today, I'll be demonstrating bed making occupied. So first, I'm going to check the patient's chart for level of limitation as well as the patient's level of physical activity. By doing this, we can check the level of activity of the patient as well as patient safety. After that, we're going to assemble the equipment needed on the bedside table or bedside chair in order which they will be used. This organization facilitates performance of activity. Next, after that, I'm going to perform hand hygiene. After performing hand hygiene, we're going to identify the patient. So assuming that we already identified the patient and explain the procedure to them, moving on, I'm going to provide privacy to the patient by closing the curtain. After closing the curtain, I will be raising the bed to comfortable working height, which enables to prevent the strain on our back and on our muscles. After that, I'm going to lower the side rail. After lowering the side rail, I'm going to put on the gloves. I'm very sorry for that. So I'm going to put on gloves. To prevent the spread of microorganisms. So after putting on gloves, we're going to use the bath blanket. Assuming this is a bath blanket, we're going to cover the patient whole body to provide warmth and privacy. Sir, could you please hold on to this? Okay, thank you. After placing it on top of the patient for privacy and warmth, we're going to take off the top linen of the patient. Okay. After removing the patient's top linen, we're going to put it on a hamper or plastic bag. Next, we're going to ask the patient to roll over to the other side. Sir, could you please roll over by assisting them? After that, we're going to lift the bed sheet. After lifting the bed sheet, we're going to fan fold it so that we can better grab it when removing it on the other side. Okay. After we adjust the patient's pillow and fan fold the soiled linens, we're going to grab the bottom linen and then place it in here. And we're going to also fan fold it so that we can use it on the other side. After that, we're going to do the miter's fold on this end. as well as on this end. Next, we're going to grab the lift sheet and fan fold it as well and place it on the center. Next, the draw sheet. After fan folding this, we're going to raise the side rail to secure the patient's safety once we turn the patient over. So, sir, could you please turn over? Okay. Now, we're going to grab the soiled linen from the side of the bed and adjust the patient's head to the pillow. Next, after that, we're going to get the soiled linen after we lower the side rails. So we're going to snugly roll this one and put the side rails back before leaving the patient and throw this soiled linens on the hamper oil or the plastic bag. Now that it's disposed, we're going back here on this side and grabbing this fan fold bottom sheet to place it. And we have to make sure that we avoid any wrinkles so that it cannot touch the patients if they have tears or open wounds. And we're going to also use a fan fold here. After that, we're going to grab the lift sheet as well as the draw sheet. Okay. Next, sir, could you please lift your ano? After that, we smoothen the sheets, and then ask the patient to go back to their position. Sir, could you please go back? Okay, thank you. Next, we're going to get the patient's pillow and change it. Sir, could you raise your head up? Okay. So that we're going to change the patient's pillowcase. Next, after putting the pillowcase on the pillow, we have to make sure that the pillowcase where it opens or where it can be accessed is opposite on the door. Next, we're going to put it back. Sir, could you please raise your head? Okay, thank you. Okay. After that, we're going to put the top linen on top of the patient's bath bed. Next, after placing it, we're going to take the hamper back. Okay. Next, after that, we're going to position our patient comfortably. So, sir, could you please, are you comfortable in your position? Okay. After making sure that the patient is in a comfortable position, we can now take this soiled linens and dispose of them. And then after that, we're going to remove our gloves and perform hand hygiene. After that, we're done. Thank you.